Today, we are 1 year into the COVID pandemic, and we wanted to speak today about how this pandemic has affected pregnant women and neonates. And first, we wanted to introduce ourselves. My name is Dr. Alison Chu. I'm a neonatology doctor at UCLA in Los Angeles, California.
Hi, my name is Annabelle D. St. Maurice, and I'm a pediatric infectious disease doctor at UCLA in Los Angeles as well.
Annabelle, thanks for joining today. My first question for you is, can you just give us an overview of where we are now 1 year into this COVID pandemic?
Yes, we have learned a lot about SARS-CoV-2, which is the virus that causes COVID-19 over the past year. This virus was first identified in Wuhan, China, and has since spread all across the world. We know that this virus is mostly transmitted through droplets. However, in some circumstances, airborne transmission can occur. We also know that individuals who do not have symptoms can also transmit the disease, as well as individuals who do have symptoms. This is one of the reasons why it's been so difficult to combat this virus, as it's spread like wildfire across the world.
So, Annabelle, since it's spreading so quickly, I'm sure many women are worried. If you get pregnant during this pandemic, are you at increased risk for catching COVID, or are these women at risk for having more severe symptoms if they do get infected?
That's a great question. Fortunately, pregnant women are not at increased risk of getting COVID compared to non-pregnant women. Most pregnant women actually don't have symptoms, but those who do have symptoms might have actually more severe symptoms. According to a large meta-analysis, the most common symptoms associated with COVID-19 in pregnant women are fever and cough. According to data from the U.S. Centers for Disease Control and Prevention, pregnant women were more likely to be admitted to an ICU and to receive invasive measures like mechanical ventilation or ECMO when compared to non-pregnant women, even after adjusting for risk factors like age, race and ethnicity, and underlying medical conditions. Women who have older age or who might have other comorbidities like obesity are at even increased risk than pregnant women who don't have these risk factors. Unfortunately, pregnant women are also more likely to die from COVID-19 compared to non-pregnant women if they are admitted to the ICU or have some of these comorbidities. Older age increased these women's risk of severe illness, and severity of illness also varied by race and ethnicity in this study.
Annabelle, that's really interesting, but it's also very worrisome, I think. Why is pregnancy in and of itself a risk factor for severe disease or these worse outcomes like you mentioned?
So we know that pregnancy actually alters some of your physiology. It can lead to increased heart rate, increased oxygen consumption, some decreased lung capacity, and alterations in your immune response to infections. Additionally, it can also increase your risk of having clotting or other coagulation disorders. We know that there is increased risk of severe illness from other respiratory infections in pregnant women, like influenza. We know that pregnant women with influenza tend to have more severe disease.
Interesting. And so I know you mentioned this briefly before, but what are the risk factors again that make pregnant women at higher risk for having severe disease?
Yeah, so being of older age or having obesity, also having chronic lung or chronic heart disease, those are all things that might increase one's risk of having severe illness.
Interesting.
Additionally, pregnant women with COVID-19 are more likely to deliver infants that are preterm than pregnant women who don't have COVID-19. So that's another possible complication. And speaking of preterm infants and infants potentially getting COVID-19 from their moms, Allie, are neonates at increased risk for getting COVID from their moms? What are some of the things we need to consider when moms have COVID?
That's also a great question. I think that's what a lot of people were worried about early in the pandemic. What we have seen is that the risk of neonates having COVID when they're born to COVID positive mothers, it's extremely low. And that's wonderful for the babies. There have been case reports where there are babies born to COVID positive mothers, and we can detect COVID RNA, for example, in the placental tissue. But we've been unable in those studies to show live COVID, and that has been reassuring. In addition, those neonates have been tested COVID negative. And so all of these things together seems to suggest that the risk of a newborn getting COVID from a COVID positive mother is exceedingly low. It's more likely that COVID positive neonates, when they test positive in the first couple of days of life, it may be that they're acquiring it from their caregivers postnatally. And that's what we believe to be true based on the few reports of babies who do become positive at some point after birth.
That's really great news. For those unfortunate instances where transmission does occur, how do those infected neonates do?
Again, reassuringly, the neonates who are COVID positive, they by and large do very, very well. So most of them have mild symptoms, if any symptoms at all. And all of the reports have demonstrated that they recover and do not seem to have any sort of sequelae from having COVID after birth.
That's great. Have any infants actually died from COVID?
Not to our knowledge, we have not seen any reports of neonatal COVID leading to mortality in this population. But on that note, I think we're all still scared about how we can, as healthcare providers, protect ourselves and our patients. So let's switch to talking about maybe some of the practical ways that we can provide care for this vulnerable population. So for pregnant women who are coming into the hospital, what are practical guidelines for us to follow to keep everybody safe?
Yeah, so that's something we've thought about in our role. That's something that I've thought about a lot in my role as leading infection prevention efforts through this pandemic. We know that pregnant women, when they're delivering and in labor, we know that there are a lot of healthcare workers involved, and these healthcare workers are often in close contact with these laboring mothers. And what we really stress is trying to identify COVID as early as possible. So I would recommend, even if pregnant women are asymptomatic, that we test them for COVID. And then in those who test positive for COVID, what we do is that we wear the highest level of PPE in order to take care of those women during the labor and delivery process. For those who test negative, we would still recommend using universal masking and using eye protection during the labor and delivery process, just in case they're incubating the virus, and also they might have a partner who's there as well. Speaking of partners, I would also recommend limiting the number of visitors who enter the hospital and screening all of those visitors for exposures and any symptoms that they might have, especially in situations where the rate of transmission in the community is very high. These are all things that you can do to protect your workforce and to protect other patients from getting COVID-19.
So as the pandemic spreads, I think we've been seeing more and more mothers come in admitted for delivery, and they've had a remote history of testing positive. So, do you guys have recommendations in terms of how long or after they have tested positive or after symptoms have resolved in terms of how you stratify them as COVID positive versus recovered?
Yeah, that's a great question. It's something that's changed throughout the pandemic. Currently, what we recommend doing is using a symptom and time-based approach. So if a woman has tested positive for COVID, we recommend not discontinuing isolation until at least 10 days have passed if she had mild illness or if she was asymptomatic, as long as her immune system is healthy. For those women who maybe had more severe disease or who are immunocompromised, for example, if they were on monoclonal antibodies or had a primary immunodeficiency, we would recommend that you wait at least 20 days before removing them from isolation. But we would not recommend retesting those women for at least 90 days from their initial diagnosis. And this is in line with the recommendations from the Centers for Disease Control and Prevention, since the likelihood of reinfection within the first 3 months of having COVID-19 is very low. We would only recommend retesting those recovered mothers if they had development of new symptoms. So speaking of mothers and infants, Allison, once the babies are born, what are some of the practical guidelines for these babies who are born to COVID positive mothers with regards to rooming in, visitation, those types of things?
That's a great question. So currently, the CDC recommends that we test neonates born to COVID positive mothers 24 and 48 hours after they're born. Like I said, overwhelmingly, we've seen that these tests return negative. So, given all of that, there has been a huge push for supporting rooming in of the neonate with the mother, even again if she is COVID positive. There are so many benefits to the mother baby dyad if they're able to room in. So, breastfeeding, if that is the mom's intention, is greatly facilitated by rooming in, as is skin to skin, as well as having the mother and the parents learn caregiving to the baby directly. So generally we encourage that the baby is allowed to room in with the mother, but of course we also want to encourage safe practices, right? So hand washing when, especially before handling the baby, the washing of breasts, which is standard before having the baby breastfeed. And we would also recommend having the mom mask when she is in close proximity to the baby. When the baby is not near mom, we do recommend trying to physically distance as possible within the room. So having the baby in the bassinet potentially 6 feet away if that's possible. And again, the same kind of guidelines in terms of visitation, limiting the number of people who are not providing direct care to the baby while the mom is still in hospital with the baby. Another important topic is breastfeeding, right? And so there's been a lot of questions about, can COVID be spread through breast milk? We greatly encourage breastfeeding. Having COVID in the mom is not a contraindication for breastfeeding. There have been studies published by groups in our own institution that COVID RNA may be detected in breast milk, but again, they have been unable to culture live virus from these breast milk samples. So that's reassuring. So breastfeeding should be encouraged in COVID positive mothers.
That's great.
And I think another question, Annabelle, for you that all of us have on our minds right now that the vaccines are available, what do we know about these vaccines in general? Can you just catch us up?
Sure. And there are a lot of vaccines that have been studied across the world trying to aim for immunity against the spike protein of SARS-CoV-2. I'm specifically going to talk about two vaccines that are both messenger RNA vaccines that have been developed by Pfizer and Moderna. And these two vaccines are currently licensed for use in the United States and the European Union. Just to be clear, these are messenger RNA vaccines. Neither of these vaccines contains live virus, but they contain messenger RNA, which tells your body to produce the spike protein, a copy of it, and then your body develops antibodies and adaptive immune response to the spike protein, rendering you immune against the virus.
So can pregnant women get the vaccine?
That's a great question. And given what I mentioned about pregnant women having severe COVID-19 disease, it's certainly at the top of the minds of obstetricians, gynecologists, and certainly pregnant women. Neither of the two mRNA vaccines that are approved for use in the European Union and the United States have been studied in pregnant women. However, there were some women who became pregnant while they were enrolled in the study. And these pregnant women seem to do fine, and there are no data suggesting that the vaccine would be unsafe in pregnant women. So at this time, it's recommended that it's really a personal decision by the Academy of Obstetrics and Gynecology, that it's really a personal decision for that woman, and that if she is in a high-risk group that's recommended to receive the vaccine, that she should make that decision on her own. And there's no evidence that the vaccine would be unsafe in pregnancy. So it's recommended that if pregnant women have questions about the vaccine, they should discuss it with their physician and should have an informed decision before making that choice.
And how about neonates or even older children? What are the recommendations, or what do we know about the safety and efficacy of these vaccines in that population?
So again, neither of these two vaccines have been studied in neonates or young children. These vaccines were mostly studied in older individuals. However, these studies are ongoing, and the current vaccine studies are enrolling children as young as 12 years of age. Again, that's not neonates. But we hope that in the future, these vaccines will be studied in younger populations in order to determine that they're effective and that they are safe in younger children.
And what about women who have maybe delivered in the last couple of months and now the vaccines are available? Is the vaccine safe to receive if you're breastfeeding?
Yes, so there's no evidence that this vaccine would be unsafe in those who are breastfeeding. And ACOG recommends currently that breastfeeding women be offered the vaccine just like non-breastfeeding women, and that there are no evidence that a vaccine would alter the breast milk or make it unsafe in any way for the breastfeeding infant.
Well, that's really great, and that's reassuring, I think. So this has been a really informative discussion. Thank you so much for answering questions.
Yeah, thank you. It's been great talking with you.
I think just to review some of the key points that healthcare providers can take away, we wanted to just emphasize the things that were most important that we discussed today. So overall, pregnant women don't appear to be at increased risk for being infected with COVID-19. The majority of pregnant women infected with COVID-19 are asymptomatic or have very mild disease, but those who are symptomatic and have more severe symptoms may have increased risk of developing severe illness or worse outcomes, especially pregnant mothers who have pre-existing conditions like you talked about. Pregnant women infected with COVID-19 who have severe symptoms, unfortunately, may also be at risk for preterm delivery. The risk of perinatal transmission, thankfully, is exceedingly low and maybe none as far as we know. And most newborns who test positive in the first few days after birth for COVID have no symptoms or mild symptoms and recover.
Yeah, and some other points about pregnancy and transmission of COVID-19 are that pregnant mothers who are admitted to the hospital should be tested for COVID-19 to protect healthcare workers and should be managed accordingly with appropriate precautions. Neonates born to mothers who have COVID-19 should also be tested for COVID in the days after delivery. Rooming in with their COVID-19 positive mother and allowing breastfeeding should be encouraged. Safe practices around breastfeeding and the child rooming in include hand washing, masking while breastfeeding, in addition to standard cleaning of the breast before feeding. mRNA COVID-19 vaccines, including Pfizer and Moderna vaccines, have not been extensively studied in pregnant women. However, it is expected that their safety would be similar in pregnant women and non-pregnant women. The currently available mRNA vaccines have not been thoroughly tested in children, and the safety efficacy of these vaccines in children is unknown. However, further studies are ongoing.
Great. And lastly, we've included some resources that we thought might be helpful, including a review article that we wrote that was published in Neo Reviews, as well as websites that link to CDC, ACOG, and WHO guidelines that hopefully will change as we understand more and more about the disease. Thank you.
Thank you.